Hello everyone, welcome back to my channel. Today we are diving into something every med student struggles with at the start, that is gross anatomy. So if you have ever felt overwhelmed by the sheer number of muscles, vessels and nerves or wondered how to even begin building your basics, you are in the right place. In this video, I'm going to share how to build a strong foundation in gross anatomy, how to attempt and approach it smartly, and the most important topics you need to focus on. So stick around till the end because by the time you finish watching this video, gross anatomy won't feel like a nightmare. It will feel like a subject you can actually master. And trust me, if you learn the right way of how to study gross anatomy, you are more than 70% done with your anatomy. Now, if I have to talk to you about how do you build your basics, you need to understand that you need to know these things very properly. So what are these things? The bones, the muscles, the arteries, the veins, the nerves, and lymph nodes. Lymph nodes is something that usually people ignore it. But lymph nodes play a very important role. So basically, I'll tell you, suppose there's a cancer in the ovary, right? Now, what happens that these cancer cells, they can metastasize to other parts like lungs, livers, etc. via lymph nodes. So lymph nodes, they are clinically very important. Okay. And as you're becoming doctors, you should always have a clinical approach. Now, if I talk to you about bones, so your osteology classes, they should be very helpful for you in order to learn your bones properly. So what do most people do? They buy their own bone set. Okay. So if you want, you can buy your own bone set. And if not, if your department is very good, they can even let you borrow a bone. Now in bones, what do you have to do? You'll have to talk about important landmarks, right? So in the bones, okay, I'll show you right now. I'll basically I use an app that is biodigital, 3D biodigital. Okay. This is the app, 3D biodigital. So it is a free app, unlike the other apps that I mentioned in my last video. And through this app, you can have a great edge on the bones. And also remember, bones is important for your vivas also. You have an osteology section in which you'll learn about bones. In the bones, you need to know about the important landmarks, important insertions of muscles, and and the region where important nerves or vessels pass. Okay. What I used to do was before going to my osteology classes, I used to draw the diagrams of all these important bones in my notebook and mark the important landmarks over there by referring to my book. Then in the class, I used to take notes. For example, I've taken radius. You can see that I have mentioned the side. It is homologous to which bone in the lower limb, about its parts like head, neck, its lateral part, its medial side, the tubercles, the ligaments associated, the radial tuberosity, shaft, the surfaces, then details about the surfaces, the grooves, the lateral part, and then I'm talking about ulna. So this is basically how you have to make notes if you're comfortable, or you can use the other way that I would be showing you. As I was talking about upper limb, so I thought of searching upper limb only. This is your scapula. This is your clavicle. This is your humerus. This is your radius. And this is your ulna. So what you can do is, suppose I want to learn about humerus. So I can easily turn also. Okay. I can zoom also. Okay. Okay. Then I can see about, so this is a bony landmark. Okay. So this is the deltoid tuberosity. So what I like about this is they have highlighted in colors about all the important bony landmarks that you should know. Okay. Now if I come to muscles. In muscles, most important is the function, but you should also know their origin, their insertion, their nerve supply, and as we have discussed, the function, that is their actions. Okay. You should know these muscles. I'm not telling you that you have to remember these things for every muscles, but some muscles like trapezius is important for that. Okay. I'll attach a note of one of my muscles. You can have a look on how to approach. Now coming to arteries and veins, you'll have to make a flow diagram of it. So now how do you approach it? Let me tell you. Now I have to talk to you about vessels. So you can draw this in your notebook. So how do you draw? Okay. So this is my heart. This is my heart. This is my left atrium. From here, the subclavian artery arises. Okay. Now it comes and it becomes axillary artery. Then it comes and it divides into deep brachial artery and profunda brachii. Profunda brachii, it goes backwards. Now the deep brachial artery continues as brachial artery. And then you can provide more divisions. So in this way, you will be very easily able to remember all the arteries. Okay, same way you can do it for thorax, lower limb, abdomen, any artery you want to learn about. In this app also I can see like this is the subclavian artery, then axillary artery, then this is the profunda brachii, divides into brachial artery. You'll also have ulnar artery, radial artery, and all over here, and then it terminates over here. Okay. Now coming to nerves. So there are a few important nerves that I have discussed at the end of this video. You will have to know the clinical course of the nerves. Basically, in Vishram Singh, for each nerve, there's a diagram given. That is the nerve supplies which muscles where. Okay, and you will also have to know about the clinical correlations associated with nerves. Right. So, for example, Erb's palsy. Okay, so you'll have to know about that. Now, lymph nodes. So, lymph nodes, I've told you in the initial only how important is it. So important lymph nodes are axillary lymph nodes. Okay, then the lymph nodes in the breast. So you'll have to look at it. I'll attach again a picture of mine so that you can have a better look. If I come to you about how to attempt a paper, so there's a golden rule for Anat. Draw diagrams, make your paper as much colorful as you can. But that doesn't mean that you will not write the proper content. You'll have to make a very good paper. That is, you can make it by including diagrams. Diagrams are a must. You cannot ignore them. So, okay, how to attempt it? You'll have to write the introduction. So basically, this is the template, but for some questions, it can differ. Okay, you'll have to create your own template. This is what I'm providing to you. But these are the basic things that you should include in every possible question. Coming to introduction. Basically, you'll have to write the site, you'll have to write the location, you'll have to write the size. Okay. Then if you're talking about axilla, you'll have to mention the boundaries. Okay. Now make sure to include every relevant embryology and histology. This gives a good impression of yours to the examiner. Okay. If possible, you can also draw a small diagram of a histology over here. Now comes body of your answer. So over here, you can write the main answer. What do you want to include in it? And also include the clinical correlations. Okay. So even if in the question it is not asked to include clinical correlations, you should include at least 2 to 3 clinical correlations of every topic. And believe me, it is not easy. Now you'll think, अरे यार ये तो बस 5 marks का है, बस 3 marks का है, इतना कुछ क्यों लिखना? No, this is not your CBSE. This is your MBBS exams, and this is how you are going to get rewarded. You cannot get rewarded on the basis of what is asked. So there are many questions in which they'll start like enumerate the content of axilla, suppose, right? So you cannot write just 1, 2, 3, 4. No. If it is a 5 marks question, you cannot write 1, 2, 3, 4. But now you'll say enumerate means listing down only. Yes, I agree it means listing down only, but this is MBBS, things work in a certain way. Now again, I told you, it depends on the question to question how you attempt, but the basic structure is same. So the basic structure is you have to give an introduction, you have to provide the relevant embryology and histology, you'll have to give the body. Body comprises of what you really want to write down, and the clinical correlations, which are a must. Let's see one of my papers. The topic is external auditory meatus. You can see that I have included introduction, extent, the relevant embryology, which is development. No histology was relevant over here. Now, if I come to body, you can see the parts. You can see the foramen of Huschke, the arterial supply, the nerve supply, and at last I came to clinical correlations. I've also drawn a diagram over here. So I hope you are clear with what do you have to write in your papers. Now coming to important topics. For important topics, you'll have to follow the PYQs of your university. Okay, so the PYQs of a university are a gold standard for your exams. Trust me, 50 to 60% of the questions would be repeated only. So make sure you do your PYQs properly. So for your reference, I've attached few questions of upper limb, thorax, and lower limb. So if you want, you can have a look. And likewise, you can create your own questionnaire of abdomen and pelvis. If you want me to provide it, please do comment. I'll surely give it to you. So I hope in this video, you got to learn about how to build your basics, how to attempt the paper of anatomy, what are the important topics. Trust me, anatomy is very easy. It just requires continuous revision, which I think you guys can do it. Okay, anatomy is easy. Make sure you give it proper time from the beginning. Do not waste your time. Be active in your DH, and I'm sure that you'll be able to sail through. So all the best. Have a very, very good year ahead. Thank you.